Hi, my name is Dr. Salman Naeem, and I'm a consultant psychiatrist working in UK. And I'm doing a career guidance series where I interview successful IMGs who are working in UK on a training post. And with me is Dr. Salman. Salman came to UK in 2015, and he's a graduate of King Edward Medical College from Lahore, Pakistan. And after only working for 6 months in UK, started his training in A&E in 2016, and currently he's working as ST4 in A&E. So I thought it'd be a good idea to speak to Salman and ask him about his life as an A&E doctor, and also how to get training in A&E, especially for the IMGs who are thinking about A&E and this specialty. Thank you very much, Salman, for joining me.
Hi everyone. Hi Adnan. Thank you for having me for the interview.
Would you like to explain, if somebody is thinking, an IMG is thinking about A&E, how can they, what should they be doing right now, so improve their chances, and what is the application like?
I think the first thing that you have to do is that you have to go through the person specifications, and that does change from year to year. So, but then the main focus is the same, that you have to score for your portfolio. You can score for exams. You can score for, I think probably now you have to score for a whole QIP. So you have to do the audit and the repeat audit, the PDSA cycle. And then you score for presentations, you score for research which has been published, or you have done any research, and you score for national and local presentations, any presentations at all. And then you also score for anything that you have done outside of medicine, which could be any volunteered work that you have done, or it could be anything. It could be your hobby that you're doing, if you won something, a prize or anything like that. And any awards that you've gotten as well. So, I mean, I don't know the list by heart, but I think the first thing that anyone who wants to plan for any kind of training should go through the person specification of that particular specialty, and just make sure that you tick most of the boxes, not all of them, but at least most of the boxes.
How many years of training you have to do in A&E in UK, and how many postgrad exams are involved in it?
So the good thing about A&E is that the training is shorter than most of the other specialties, except for a few. So it's about 6 years in total. So 3 years of core training, and then 3 years of higher specialty training, which is called HSC training. So yeah, but the bad thing is that you have to give about 7 exams in total. So there are 3 that are part of the core training. They have to finish before core training, and then the 4 of them which you do in as a part of HST training. But at the moment, because of the new curriculum, the exams might change. So they might decrease the number of exams, or they might just change the type of exams. So things are changing at the moment.
So, and for the whole 6 years of training, do you stay in one place, or do you have to move between the trust or the areas?
So previously, I think about 3-4 years ago, you had to move to different places as well. So within a whole region, you might have to move to a different region. But now, I think from the last 2-3 years now, especially I'm currently in Kent, Surrey, and Sussex. So they tend to keep you in a single county. So if you start in Kent, then you might stay in Kent for the whole of your 6 years. It's only for the trauma rotation that you have to go to different places. But deaneries are becoming more and more proactive in keeping people in a certain area, so that they don't have to move because people drop out. And in order to curb the rate of dropout, they're trying to keep people in a single area. So for me, I have rotated to 2 different hospitals in the last 4 years, and they've always been about 30 minutes from where I live, so it's not too far as KSS is concerned.
Okay, and the other thing which I wanted to ask you, a lot of IMGs are interested in A&E. They always ask about it, but they always also get some feedback from their senior IMGs that A&E is not really good for your work-life balance and your family life, because there's so many on call, so many nights, and so many odd hours. So how do you find your life as working in A&E doctor? Is it something that excites you? And
Yeah, I think to be honest, one of the reasons that I chose A&E was because it does give you a good life balance, but I think it just depends on what kind of personality you have. So I tend to enjoy getting days off or starting late days during weekdays so I can do some extra work or bank work or anything like official work that I want to do during the day hours. Uh, and plus, I get to have days off on weekdays plus the weekends. So for me, I think it's just a very good life that I have with A&E. I know some people don't like working on the weekends, but as I said, I think apart from the 6 months you do as a SHO, which are tough in A&E in your core training, as soon as you come to the registrar level, which is the HSD level, ST3 and onwards, uh, rota is quite good. And in many places, especially if you look at the South region, Southeast and London region, they're introducing the self-rostering. So now you can pick and choose whichever shifts that you want to, whenever you want to take days off. So I think for me as a registrar, it's a very good life balance for me. I tend to work about, so currently I'm working on an annualized rota, which means that all of my annual leave and everything is taken off. I'm working about 26 hours per week. Uh, I don't think any other specialty offers at the moment. And apart from the working environment, I mean, I know that it's slightly busier than working on a ward because you're on your toes all the time. You're seeing patients, but I think the good thing about it is that the time goes past very quickly. And as soon as you're done with your patients, you go home and that's it. You don't have to think about them, uh, as long as you haven't made a big blunder. You just can close your eyes and go to sleep and come to the work next day and start fresh. So you don't have to keep on continuing the same patients, which I tend to enjoy.
okay. And the other thing IMGs also ask about the scope of A&E. Once you have done your training in UK, you completed your training, have you explored, A&E's scope in other English-speaking countries and other countries if you want to go abroad after working in UK?
Uh, I think A&E, all among all the acute specialties, I think A&E is in quite in demand in the whole of the world at the moment because most of the countries are now moving towards an acute care setting where they are introducing emergency doctors and emergency physicians all over the world. If you take example of Pakistan, I was one of the few first trainees we started in the CPSP program for A&E training, and slowly it is. When I started, there were only two hospitals providing training in Pakistan, but now slowly it's running out to I think there are about 8 or 10 hospitals now that are providing A&E training. So if you graduate from, or if you do your training from England, uh, there are opportunities, except for I think for America. You can go to any other country in the world where you can work over there. You can go to Canada, you can go to Australia, you can go to Middle East, you can go to Africa if you want to. You can go and work in Europe as well. So I mean, the possibilities working as a consultant are endless. You can go essentially anywhere and you can work over there as an A&E consultant.
And as a consultant or as a senior trainee, can you develop some special interest? Because for somebody like me or a new IMG, A&E might look like a very single sort of specialty. So are there any subspecialties within A&E that people can explore?
Yes. To be honest, our college, Arkham, is quite proactive in providing support for people to develop their special interest. Currently, you can, as an A&E trainee, you can do dual training in intensive care, and you can also dual train in pediatric emergency medicine and also in pre-hospital care. Apart from that, currently there is a big, what's it called? There's a big campaign going around the country about getting more and more A&E consultants and more A&E trainees involved in research. So they are quite encouraging people to become academics in A&E, and they're promoting people to become professors as well. So I think you can develop interest in any field that you want to. You can do special interest in point of care ultrasound. You can do special interest in academia. You can do special interest in medical education, simulation training. I mean, the opportunities that are endless.
So if a young IMG or a medical student is sort of thinking about A&E career right now, what should they be doing to improve their chances of getting the training? I mean, you talked about initially that looking at the person specification and sort of working through that and develop those marks which you can get through the person specification. Is there any more advice for IMGs? When they first come here, what should they be looking for to improve their chances?
So I could just tell you what I did when I came over here. So initially back in Pakistan, I did a part of training in Pakistan. So I did do a bit of research. I published a few cases. So I developed my portfolio from there. Uh, Although the competencies that I had over there were not approved over here, so that's why I started from beginning, from ST1. But once you come over here, I think the first thing that you should be doing is making sure you get the CREST form signed off so that you can apply for training. And one of the other things that carries marks is an audit. That's an easy thing to be done. It takes about a week if you want to do a simple audit, and then another week to do a PDSA cycle. And then you can get that published in so many conferences. There are conferences going around the year. There are special quality improvement conferences. You can also always uh, project yourself on the RChem conferences, and there's so many conferences. I don't know, HSCA conferences, medical education conferences. So these are easy things that you can do to score some points on the portfolio. And with regards to filling the application form, you just have to be a bit more creative. So I didn't know when I applied, I didn't apply for anything outside of medicine. But now looking back at what I did, uh, I've seen people just putting on their hobbies as their achievements outside of medical education. So you can always if you're doing cycling, you can just do that. You can just say that I did a marathon or I ran in this event. You can put photography as your achievement. So you can put basically anything that you do outside of medicine can be put as an achievement. So you just have to be a bit more mindful and tactful how you fill up the application form so that you score the maximum. Obviously, there are things that require certificates like presentations and publications. But then there are things that don't require certificates, and those are just those things that you can just say that I've done them, and they will take your word for it.
No, that's fine. Thank you very much for your time and giving us the opportunity to give us an insight into the life of a A&E doctor.
I think it's a good, yeah, thank you so much for having me.